warahmatullahi wabarakatuh. My name Ahmad Hushil Ashraf bin Muhammad Sani. So I will explain the definition of the depression. Okay, so firstly, what is the depression? Okay, depression can be defined as the major depressive disorder, which is the common and the serious mental illness that will affect negatively for the someone life. So when the someone have the variety of the feelings and bad negative vibes, it will decrease the ability of someone to doing the good activity and good job in their life. Okay, so I will explain a few of the symptoms when someone have the depression disorder. So firstly, they will feel so sad and stressed. And the second one, the depression will make someone to lose their appetite and disturbing their sleep cycle. And the third one, they will feel the lack of the consciousness, the lack of the focus when they are talking. And the last one, they will have a difficulty during thinking and make a decision. So there are the few factors that will cause and lead to the depression disorder. So for the first one is the environment. So the example for the environment is the abuse or the social problem that will affect to the someone. And for the second one is the self problem or the others problem, when the someone cannot solve properly. So when the someone cannot solve the problem, it will make the problem and the someone become more stressed, and the stress will lead to the depression.
Okay, next we proceed to the side effect of depression. Okay, for those who have depression, they might feel emptiness and sadness day by day, and this may be because of symptom of the depression. The second one is insomnia. Depression can keep the person to stay awake at night. That may lead them to feel uncomfortable and distraction to release their mind to get asleep. Okay, next, depression also can cause the trouble in memory or decision making for the person. They might be troubling to remember a lot of things and hard to make a decision for themselves. Lastly, the depression can lead the person to do something that can harmful themselves. Okay, they might do something that can injure themselves so badly. Okay, if they keep injuring themselves, this can increase the risk of suicide to the person.
Okay, now I will present about how to handle the depression. Firstly, building a supportive network. It is important for surround ourselves with family and friends for comfort and support in both time, joy and distress. Based on my research, supportive relationship is a strong protective factor against mental illness and help to increase our mental well-being. Second is psychotherapy. Psychotherapy, also known as talking therapy. Speaking with therapists can help a person cope with negative feeling. There are two types of psychotherapy. First is cognitive behavioral therapy, CBT, and the second one is interpersonal therapy, IPT. Cognitive behavioral therapy is used to help people with depression, destructive, negative thought pattern. And interpersonal therapy is used to help people understand and work to troubled relationship. that may cause their depression. The third way to handle depression is drug treatments or antidepressants. Antidepressants help to treat moderate to severe depression. There are many types of antidepressants that can patient use. First one, selective serotonin reuptake inhibitors, SSRIs. Second, monoamine oxide inhibitor, MAOIs. Third, tricyclic antidepressant. Fourth, atypical antidepressant. And the last one, selective serotonin and non-peripheral reuptake inhibitor, SNRIs. A person should only take this medication as their doctor prescribed. Some of the drugs have potential to experience side effects such as diarrhea, constipation, low blood sugar, sex dysfunction, and so on. Point number 4 is natural remedies. Natural remedies used to treat mild to moderate depression. There are 3 natural remedies that we can use. First, ginseng. Ginseng used to improve mental clarity and reduce stress. Second, chamomile. Chamomile contains flavonoid that may have an antidepressant effect. And the third one is lavender. Lavender may reduce anxiety and insomnia. The fifth point is food and diet. For your information, eating a lot of sugary or processed food can be lead to various physical health and mental problems. This lifestyle need to change to make sure our body and mental healthy. Based on medical news today, the study found that eating fruit, vegetable, and fish and olive oil can help reduce depression symptom. Next is brain stimulation therapies. Brain stimulation therapies are another treatment options. For example, repetitive transcranial magnetic stimulation send magnetic pulse to the brain, and this way will help treat the major depression. If the depression does not respond to drug treatment, the person may benefit electroconvulsive therapy or ECT. This may be effective if psychosis occur with depression. The last point is exercise. Exercise should therefore be considered as an important lifestyle change that is used to, in addition, other treatment for depression. Based on my research, aerobic exercise will raise our endorphin level and stimulate neurotransmitter of norepinephrine, which link with our mood. For treatment, exercise may release mild depression. For the recommendation of the exercise, the person need to do at least 30 minutes of low to moderate intensity of physical exercise a day. The person also need to do 3 times a week, which at least for 8 weeks.
So I will show the first exercise, which is the half moon pose. So firstly, the first leg must bend at the front, and the one leg at the front. And then for the another hand must have the leg at the back, and then rise the back leg to this position, and then lift the knee joint, and then lift the knee joint. So, and then the other hand must rise up like this. So, the patient must focus to maintain the stability. Okay, for the second exercise, child pose exercise. So, also from the yoga exercise. So, I will show the demo of the child pose exercise. So, firstly, the patient legs must bend like this, and then move the upper body to the front and downward, and the hand must straight like this. Then down all the body to the downwards to the front, and hold for a few seconds. Okay, for the Thai pose exercise, the requirement of the duration during do this exercise is around 30 seconds each sets, and the patient can do from 2 or 3 sets. Okay. For this exercise, the benefit is the patient will feel better and relaxed during do this exercise, because this exercise is the combination of the stretching. So during the stretching, more the blood flow and the patient will feel more comfortable and release their stress. Okay, so for the other infos, this exercise is the good exercise for the person who has the lower back pain.
Okay, now we will do the easy pose, which is the pose from yoga exercise. Okay, first, sit on the floor and cross your legs. Straightening your back and move your shoulder to the back and down. Put your arms on your knee, close your eyes and take a deep breath. Focus your attention onto your heart. Remain on this position as long as you like. Easy pose is a pose that helps to regain your confidence in order to deal with depression, anxiety and stress. Okay, now we will do the upward facing dog pose. Okay, first you need to lying on the floor on your stomach. Make sure your both feet is facing upward and your toes is pointing down. Put your arm near your shoulder blade. Push your upper body and smoothly curve your spine. Lift up your chest and your feet and your head. Take a deep breath, a few, before you getting back to the early posture. For the upward facing dog pose, each position helping to open the patient heart, which is helping to remove any negative emotion in the chest. It is also helping to regulate our respiratory system and helping to bringing the clarity to our heart and mind. Okay, now we will do the standing forward full pose. Okay, first we need to stand straight with our hand beside. Now, slightly bend your knee as you bend forward with your hand beside your hips. Then grab your ankle and make sure that your thigh is touching your chest. If it doesn't, try to bend a little bit your knee. Take a few deep breaths before you standing back up. Standing forward for a pose can help to release tension at our neck, shoulder and back. It also helps to regulate blood flow to our brain. Okay. If the patient practicing regularly of this pose, it can help to release tension and make them feel better and feel great.
Okay, for the first step, you need to lie on your back. Your feet need to flat on the floor and make sure your hand next your rib cage. When you inhale, press the back of the shoulder and your feet into the floor and lift hips up. Stay for 5 to 15 breaths. To come out of the pose, you need to release your arm and roll your spine. Okay, for the first step, begin with your hands under directly your shoulder and your knee directly under your hips. For second step, stay with your spine in neutral or long position. When exhale, pull your belly in, round your spine and relieve your head toward the floor. Make sure you actively press the floor and feel stretch on your back. For the last step, inhale and come back to the neutral starting position. For the first step, you need to lie in on your back. Take your feet as wide as your mat and allow your feet to fall open. Turn your palm up and place your hand slightly off the mat to give yourself space. For the next step, close your eyes, breathe in deeply through your nose and exhale deeply through your mouth. Allow your entire body to relax and be present in this moment.